Welcome back to Passionate World Talk Radio. Educate, enlighten, entertain. And this morning on Cool Your Heels with Lillian, our special guest is Jan Dubauskas, and she's the Vice President of Health Insurance. So good morning, Jan. How are you?
Doing great. Thank you so much for having me on today.
Well, I think it's important for people to realize that there are ways getting around the financial woes that your survey has picked up on. And since mental health is in April, I thought it'd be a good idea to reassure people that even though your survey did find most Americans are unprepared, that there's always light at the end of the tunnel.
That's right. There sure is. Yeah.
So please explain what your company did and why your company did it.
Sure. So at healthinsurance.com, what we like to do is take a pulse on the community and find out what's really going on with consumers so that we can help consumers and we can make sure that our products are what consumers are looking for, but also we provide a lot of information on our site, a lot of articles that can be really helpful to people. So we put out periodic surveys, and what this survey did was we looked at, how are people feeling throughout the pandemic? How do they feel about medical costs? Have they lost their job? Are they using telemedicine? What sort of services are they using? Do they know what their options are in case they lose their job? How many people have lost their job? Things like that, and really trying to understand what's going on with the consumer base. What we found is that there are a number of people who really feel that medical costs should be as transparent as those on a restaurant menu. 90% of consumers responded that, we really should know what our medical costs are right up front. And that's actually a pretty reasonable thing. And it's what Trump is working for with this pricing transparency that's going to come out in 2021, is that people really want to know, if I go to the doctor, if I go to the hospital, how much is this going to cost me? I think that's a very reasonable question for consumers.
Yes, I think it is. But the problem is that if you have to ask for the price, it's too expensive. Ever been to a restaurant like that? Yes. And I believe from also what your survey showed was that a great deal of the Americans, over 50%, really don't know what they would do if they had to go to the hospital because of the C virus, because the average day is 4 weeks.
That's right. Yeah, there are a certain amount of people who are going to avoid the doctor's office. More than 40% are avoiding the office because they're concerned about the costs, and you really can't blame them for that. But what that does is it does create this sense of, oh my goodness, there are people who should be going to the hospital who aren't, just because they're concerned about the cost. And that's a pretty big negative there, just like you pointed out. We also have, over 50% of people don't know what their options are if they lose their job and they lose their health insurance. And so we have a gap in education on what are the options that are available to people. They can continue their COBRA. They can, if they have a spouse, they can potentially go on their spouse's plan. They can buy short-term medical. They can, there's a lot of the telemedicine, a lot of options available to people. So I think some of this is about education, and then some of this is about we really need to rein in our medical costs.
Well, and the pharmaceutical costs. I don't remember having you say anything, but my husband was an organic chemist and he worked with a lot of pharmaceuticals.
Yeah.
And he was telling me that a lot of the prices that they were quoting, for example, on television, he says, were outrageous for the amount of money it really took to produce that one pill or to produce that one serum that you would need to get 2 or 3 injections per year.
Right. A big part of the pharmaceutical costs that are managed well with healthcare, with health insurance, is just the network discounts. So what we really need to make sure is that those who are uninsured have access to the prescriptions that they need. There are free services that people can use. GoodRx has a great service that's free. People can sign up for, and they'll get big discounts using that service. There are also insurance products that people can buy that just cover prescriptions, and so that's helpful to the consumers today. But you're pointing out overall that we have an issue with the cost of services for pharmaceuticals as well, and that's just true. That's something that we need to work on for sure.
I was going to ask you, who pays for the difference when you use those RX cards or those apps that you can now take with you to the drugstore? And go through the 4 or 5 or 6 companies and compare them and then choose the one that's cheapest. So who makes up all that difference?
Yeah, so there's the pharmacy benefit manager. There's a whole big group of people that are in between the pharmacist and the actual manufacturer of that, and so those costs are absorbed somewhere in the middle. And what is the benefit is that the consumer pays the best price possible when they do shop around. Whether it's the pharmacy receives less income because they took in less, whether it's the pharmacy benefit manager gets less from the pharmacy, or the manufacturer gets less from the pharmacy benefit manager. That's all inside baseball there.
I would think that they would just sell it at the price that RX and those other apps are offering. If that's the accept, I mean, it makes sense to me because it seems like they're going to lose money anyway because they're absorbing that difference. So if medicine's $60, $70 and the patron is only paying $5 to $10, well, why don't they just do it that way instead of having all this hocus pocus that's added to the cost?
Well, sure. And you can say the same thing for healthcare, right? If you have a Cigna discount at one hospital, you have a Blue Cross Blue Shield discount at the same hospital, you have no health insurance at the same hospital, you'll get 3 different prices. So why aren't prices more easy, more fair across the board? That is the entire healthcare industry is built, around these pricing disparities. And so what we need to do is really think about, how do we continue to have these entities be profitable, but also like what's best for the consumer in the meantime. And it's very complicated, actually. And so I think that we need to just get a little bit more deeply involved each time. What we started with ACA was healthcare reform. Remember the conversation with healthcare reform.
Yes.
And what we ended up with was health insurance reform. Now, health insurance companies, they just work with the costs that are given to them. They try to provide the best discounts they can. And then that's reflected in the premiums that people pay. But health insurance companies don't control the costs. So we really need to get back to the conversation of healthcare reform, which goes back to the basic cost that everybody's paying. And that's going to have the most impact in the long run.
Has your health insurance company, I'm just curious, have looked what's going on with Medicare? They're saying that within 4 or 5 years, the system is going to collapse. And I, for one, was delighted when I finally got on it because before I was paying way over $1,000 a month.
Oh, wow.
Because I had a pre-existing condition, so I was being punished for it. And of course, now Medicare takes care of my knees. Not that I'm that sick, but I'm just curious how your company, as a health insurance insurer, feels about the fact that if Medicare collapses, you're going to have all these senior citizens, which is the baby boomer generation. Yes, I'm a member. How is the insurance company looking at us? Kind of like the great white shark and the Oprah whale waiting for us to be fed upon as soon as Medicare collapses?
So let me just give you a quick description of what we do. We actually are focused on the senior market. We sell Medicare Advantage and other Medicare products, Medicare supplement to the senior market. We're not an we're not a carrier, we're not an insurer. We are a marketer of those products, and so we are deeply involved and care deeply about our seniors. And we do actually get involved in government relations and work with different congressmen and senators and with HHS to talk through our programs, our consumer base, what they need, and are staying involved in all of that. And of course, what we're doing is advocating for the seniors and appropriating funds to ensure that Medicare continues, because we do see it as a very valuable program. Any senior that you talk to is relatively happy with their insurance and with the program that they have compared to what they had before. So we want that to continue. And we've seen some really good things with the CARES Act that came about because of the pandemic, where telemedicine restrictions have been loosened up so that seniors can talk to their doctors over the phone instead of having to come into the office. Huge benefit to seniors to be able to avoid potentially germy situations in the doctor's offices. So I think that the administration is excited about Medicare. I think they want to continue it. It's just a matter of how are we going to appropriate all the funding and things like that for it.
So you talk about education. What kind of does your company yourself offer these educational systems, or do they point people in the right direction as where they can be educated about where the insurance market is going? Because that's a real big concern. It's maybe not voiced, but it really is a big concern.
Sure. So on healthinsurance.com, we have lots of articles about different types of health insurance that describe, the benefits of an ACA plan, that describe the benefits of a Medicare Advantage plan, that describe the benefits of a short-term medical plan, the pros and cons, all those types of things. We talk through, what are some of the definitions of deductible, copay, all of that stuff, trying to educate consumers. What is insurance and what does this really mean for me personally? We have a lot of videos, things like that. It's a wealth of information. We sort of stay away from the political side of it, just because we want to make sure that people can come to us as a trusted, unbiased resource for information. But we do definitely, have resources that we turn to. So we look to, what's going on in the news. We, one of our affiliates, Health Pocket, also provides a lot of information in an unbiased way. And so we're out there in the community trying to help people. And of course, if anybody has any questions that have not been answered on healthinsurance.com, we would love to hear what those are and absolutely to address them.
Very quickly, what are I'm just curious, again, who pays for all the extras for the Advantage Plus from Medicare? I mean, I get all types of information coming in through the post office, of course, and there are the ads on TV, but I've also heard other stories where even though these services were told that they were going to receive them, they don't get them, and that their care is less than if they had remained with the original Medicare. So certainly when I hear stories like that, I hesitate to really even call up and find out, because they seem to be offering a lot of extra stuff with your Medicare. And again, you wonder, well, who's footing the bill for all this?
Sure. So with Medicare Advantage, what happens is the federal government gives the carriers a certain amount of money for each individual to manage, and they have to pay claims, they have to pay these gym memberships or whatever those freebies are within that certain amount of funds that they get every month. So if you, we work a lot with a variety of the large national carriers. And so if you are offered a gym membership or, a tablet to monitor your diabetes or your weight management, those are all paid for by the carrier with the funds that they were given by the federal government. So if you have a zero premium Medicare Advantage plan, you shouldn't be paying towards those things. And if a consumer is not getting them, they should absolutely, go to the carrier immediately and talk to them and find out why. Was there a misunderstanding, or maybe the carrier made a mistake? But you should definitely ask those questions, approach the carrier. But the first step is to make sure that we understand clearly from the get-go, before you sign up for the plan, what the benefits are.
Yeah.
And ask all the questions. Take your time. If you talk to someone over the phone, our typical calls can be an hour talking with someone about what are the benefits of the plan. So don't feel shy. Most seniors don't feel shy about asking lots of questions to make sure that you have a real clear understanding of what you're getting, so that then when you do go to receive those benefits, you receive exactly what you're expecting.
And if you do not receive them, do you have a place where you can make a grievance against it?
Absolutely. You can contact the insurance carrier directly. You'll have their number with their card. You can go to your state Department of Insurance and make a complaint online there as well. So there's a number of ways that you can communicate.
Oh, excellent. Very good. Okay, Jan, could you please tell everybody where they can find you, where they can be educated? Because I really believe that you're right. Education is this misstep because people don't know. I know the millennials need a lot of hand holding. And if you're a millennial, my apologies. That some of them really are clueless about life's little adventures. And I consider insurance an adventure. So could you please give them all that information?
Yeah, you bet. So you can reach us on healthinsurance.com, and we have a library of information. Happy to communicate with someone. We have a chat area where if you have any questions, you haven't found something, you can go ahead and let us know. We're happy to communicate with anybody at any time. You can also find us on Twitter, Facebook, LinkedIn, Instagram, and follow us there as well.
Terrific. Well, you heard it here with Jan Dubauskas. Did I kill your name? Probably.
Dubauskas. So it's all right. Everybody
It's
does.
okay. I'm all right. I'm glad to hear that. Anyway, moving right along, you can see this video on Facebook Live /PWR Network, twitter.com /PWR Network _ LLC or at LLC, something like that. YouTube.com /PW Talk Radio. Also, you can see it on AMFM247.com on their TV channel. And you can also see it at https://passionateworldtalkradio.com. Scroll down right-hand side, look for Cool Your Heels, and you'll see it posted there. And you could probably see it on healthinsurance.com because we send them the MP4 stream so they can help promote their company for marketing and promotions. And before you go away, G.K. Chesterton had this to say, in 1963, you could only find truth with logic if you've already found truth without it. Okay. Thank you all very much for listening. And remember, please stay healthy.
Thank you.
You're very much welcome.